Thank you, Tina. Good afternoon, everyone. Before I turn it over to Dr. Strang, I just want to pass on my condolences, that of all Nova Scotians, to the three families who've lost a loved one due to COVID. One of the terrible realities of COVID-19 is that we're not able to mourn the way that we are accustomed to mourning. So those families who have lost someone during this period of time, I want you to know it is not lost on all of us. Not only are you going through the grieving process of losing the person you love, but you're also having to do it in a very different way. And it is on our minds heavily, and you are in our thoughts and in our prayers. And Nova Scotians are with you as you transition through this with your loved one and your family. Dr. Strang.
Thank you, Premier, and good afternoon, everybody. As the Premier said, unfortunately, we have to report 3 additional deaths at Northwood, and my condolences as well to those families. We now have 51 Nova Scotians who have died of COVID-19. Today, I'm reporting 4 new cases of COVID-19, which brings the total number of confirmed cases in Nova Scotia to 1,024. All 4 of those cases are associated with Northwood. We have again today we have no community-based cases, which is good news. Yesterday, the QE2 labs processed 502 tests. We currently have 9 individuals in hospital, 4 of those in the ICU. We have 870 people now who can be considered recovered, and 34,604 people have been tested and have negative results. We continue to have three licensed long-term care homes and unlicensed seniors facilities with active cases of COVID-19. In Northwood has 64 residents and 13 staff with active cases, and one other facility has a staff member, and a third facility has 1 resident with an active case of COVID-19. As I say every day, it's still important that Nova Scotians who have symptoms that could suggest they have COVID-19, that we continue to have those people reach out and be tested early on. So if you are positive, we can have rapid follow-up by public health around isolating cases and quarantining contacts. So if you have 2 or more of fever, new or worsening cough, sore throat, runny nose, or headache, if you think you have COVID-19 and have 2 or more of those symptoms, go to the online 811 assessment, and if you don't have internet capacity, then calling 811, and they'll walk you through a further assessment and direct you to testing as necessary. At yesterday's briefing, I addressed some of the questions that the media and the public had about the difference between the numbers of active cases we were reporting provincially and active cases in long-term care. As I explained, that much of this difference was due to the fact that we're using 2 different data sets and different timelines from those data sets. Public health has been actively working diligently since the pandemic. We've been tracking, tens of thousands of test results and hundreds of active cases. We continue to refine our testing processes and doing audits and reconciliations on our data like we do all the time. That in the last 48 hours that we have done a lot of that work with our around recovered cases and been able to reconcile that data. And that's why you'll see today that Northwood's active cases among residents dropped from 157 to 64. So we have a much truer picture of our number of active cases. People may, if they have sharp pencils and do math, they may note that the active cases among staff at Northwood has risen from 8 to 13 today. And that's a result of 5 members that, as we did the review of the long-term care data, that they had been listed as recovered, but their cases were still active. So we've made that correction. I think it points to the complexity of all the data we have, but also that we have an ongoing work around that we do this auditing and validation periodically to make sure that our numbers remain true to and accurate. And so we have that. I just wanted to bring that to people's attention. And as I said, and I noticed yesterday lots of people were doing math, and so we want to make sure that you understand if there's differences in the numbers that you see today. Premier.
Thank you, Dr. Strang, and now we'll be happy to answer any questions you may have. Tina?
Again, just a reminder, we'll take one question and one follow-up from reporters on the phone in the allotted time that we have. Please ensure that your phones are on mute. We will start with Shayna Luck from CBC. Go ahead, Shayna.
Hello. Dr. Strang, you gave me a good explanation last week about randomized testing. It's not a good strategy, I understand. So I'm wondering, do we have any other possible ways to get a handle on how widespread asymptomatic carriers might be, and where are we at in that process?
So we're looking at some options that you know, we're still working public health and our clinical folks. I'm looking forward to bring those for some consideration in the next few days. That we may use selective settings that do a random sample of people that would give us some sense. Ultimately, what's going to give us really good information on asymptomatic spread is doing. I've talked about before. Nationally, there's discussion about doing a sero survey. So you do a sample of people across the country, big enough that you can get representative numbers from each of the provinces and territories, and then through that you get a sense of how many people have been actually immune from wave one, and then we could match that up with the number of known cases we have, and the difference would give us an estimation of the number of people that weren't recognized, either they were asymptomatic or never came forward for testing. So work is actively underway at a national level around that sero survey type research, but also, as I said, we're actively looking at some strategies to bring forward for people like the Premier to understand, and then we will move forward and to implement those.
Go ahead, Shayna, with your follow-up.
The other Atlantic provinces have all moved to two-bubble households. Wondering what kind of conditions have to be present before Nova Scotians can do that?
So, I mean, I've certainly explored that. We've just had some conversations today about bubble families, whether that's actually, you know, whether we're ready to do that or whether that actually makes sense. The bubble family concept is actually fairly complex. We've had conversations with New Brunswick about that, and they've had to invest a lot of time in communication and helping people to understand that. There's still many challenges to that because you're still limiting between making families make a choice potentially. They can visit one set of relatives, but they can't visit another set of relatives, or maybe they have to choose between grandparents or grandchildren. So you know, there are some you know, some pros to that, but there's a lot of, it's a complicated piece actually, and so we continue to look at that, but we're also continue to look at ways moving forward as we're doing our consultation in a range of sectors and bringing forward a package of things that would be phase one in our recovery strategy. We continue to look at what, you know, right now we have a limitation on social gatherings, essential social gatherings only for 5 people or less. That maybe the way to do this is not bubble families, but loosening off some of the restrictions around what types of gatherings and the numbers that are allowed. So we continue to look at what actually makes the most sense in Nova Scotia. For those, along with our other measures that we've been looking at, bringing those forward into government for consideration about what a whole package of measures in phase one could look like.
Next, we'll go to Graham Benjamin from Global. Go ahead, Graham.
Hi there, this question's for Dr. Strang. We received word that a second building at Northwood has been impacted by COVID-19. Is that the case, and what measures are being put in place to address that?
So actually, that's not a second building. They have the second part of their building, which is called the Manor. They've had a floor which previously didn't. They've had other floors on the Manor side which previously didn't have cases, or sorry, previously had cases. The current floor hadn't, but they had a new case on that floor the other day, and so what they're doing is testing everybody on that Manor floor. But it's not a new building. There have other floors in that building have already had COVID cases.
Graham, with your follow-up.
Yeah, just to what you were saying previously too, Dr. Strang, that there's 4 new cases today, and then there's one yesterday. And you said 4 of those new cases were staff members at Northwood. Was that one case yesterday also a staff member at Northwood, as there's now 5 additional staff members?
No, my understanding is that, sorry, and that I said the 4 cases, there were 2 of them were residents, 2 of them were staff. The 1 case yesterday that as we did further follow up, that is a healthcare worker linked to Northwood, and so those are the numbers we have, and we continue to see ongoing testing of staff. That's why we may still having some turning positive. We continue to test as necessary residents, but ongoing in my conversations with the staff at Northwood, what they're seeing is that many residents can be tested multiple times, and it may be on the 3rd or 4th time that they're tested that they actually test positive, and so but their exposure may have been even a few weeks ago. So it's very interesting how this virus is playing out, and how long it takes potentially for somebody who's been exposed to actually have enough virus in the back of their nose and throat to have a positive test.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. I just want to go back to the bubble family idea for a minute. Premier and Dr. Strang, we know that obviously Northwood is the epicenter of this epidemic here, and I'm just wondering whether or not you think the idea of increasing the number of people you're allowed to be around, or looking at the bubble family concept, would that help the mental health of Nova Scotians, especially those who live alone?
So we're absolutely aware of mental health, and so that was why we have introduced outdoor increased access to the outdoors. We're actively looking at ways we do that even further, along with how we may safely allow Nova Scotians to have more social interaction. As I said, the bubble concept is one way to do that, but there are other ways to do that as well, and so we're exploring those other options. But I absolutely agree with you that that mental health is an important piece, and again, that's why we're very proactive in allowing people to have more activity outdoors to help address those mental health concerns.
Go ahead, Natasha, with your follow-up.
Thank you. I'm wondering about phase 1 of the plan. I know we don't have an official reopening plan yet, and that's still being worked on. But I believe when you folks addressed it on Friday, you said there'd be more details about potentially phase 1 coming up soon. Can we expect that this week, and can we expect the idea of increasing the number of people we're allowed to be around, or the bubble family concept, to be part of that?
So I don't think we're there yet. I'm in the middle of consultations with a range of sectors, and so the concept we talked about on Friday was that final decisions on what actually happens in phase 1 is going to be informed by the public health framework that I introduced on Friday, which is based on the national framework, along with the epidemiology as that evolves. And the third part is really important, which all the things were coming in from our various sector and how all those plans necessarily fit together. I'll use an example. I met today with the Nova Scotia Veterinary Medicine Association. So they have a plan that they're going to make a few changes to based on their conversation, but then that plan then needs to come in that the vets are done not alone, but in linked in with a range of other opening up or other expansion plans from a range of other businesses and sectors. So we're I still have to get through all that consultation process and bring a package back in for consideration. So certainly not this weekend, but we know that our epidemiology is leading us to a point where we're within the next very few weeks we should be able to do something.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Yes, hello. A couple of questions for the Premier. On PPE in particular, I wonder what you can tell me about where we stand in terms of overall supply, and then within that, what do you know of the role of local firms who have retooled to actually help with that? My understanding is that they've made a significant difference as a stopgap measure. Is that your understanding as well?
So we have supply for about 90 days. That not only will allow us to deal with the healthcare system, but as well supporting those private sector entities which have provided PPE when we started this journey with the pandemic. Our goal is, as we start opening up the economy, that we will broaden the work that the Deputy Minister Fred Crooks is doing in and around across government procurement to allow the private sector to actually feed into that, so that when we make an order, we'll get a good sense. I have another call today with the Atlantic premiers We're looking at what does an Atlantic version of supply look like, and I don't mean what we currently have, but how do we ensure we build a network of companies that can continually on an ongoing basis supply the region with PPE. And you're right, Wear Well, Stanfields, to name a few, but many companies have been working, provide shields, and some of them beyond the PPE have found a way in to provide those barriers that are being used in some of our other parts of our economy to help move forward. But it's certainly been much easier for us to be able to order that or supply locally, and that's what our goal is to continue to enhance and strengthen that in the months and years ahead.
Go ahead with your follow-up, Keith.
Yes, Premier, it's on unrelated. It's we now have witnesses who are saying that domestic assault and weapons held by the gunman in the shooting rampage were reported to the RCMP 6 years ago. It's kind of adding to this clamor for some sort of public inquiry the more we learn about some of these things, and not necessarily initially from police. I'm just wondering again, we've been over this ground, but I think we should ask you yet again, will your government commit to an independent public inquiry, look at these and other issues coming out of Nova Scotia's mass shooting?
So, as you know, there's an ongoing investigation with the National Force. The federal government is working with the organizations what they determine they're going to do around this mass shooting that happened in our province. We'll wait to see. The Attorney General obviously is working with his partners at the federal level, but that's not been determined. We'll continue to follow this. I don't know. I mean, I've read the reports that you had around the domestic violence piece. I'm not at all. I don't know the details associated with that, but I want to move away for a second from that mass shooting. I think we have to come to terms with the fact that domestic violence is happening in our province, that women and children are afraid in their homes. And the results are not necessarily to the extent we saw, but we are seeing too many of our daughters and sisters living in violence and fear and staying there because of their children, or staying there because of the fear of their lives. And we need to have an open and frank conversation about how do we address this issue in our province. You've heard me talk many issues on some historic problems that have faced our province. We can't avoid them. We need to take them head on. And we as a government will continue down this path. It is just completely unacceptable, in my view, that in this day and age that women and children are still feeling afraid in their homes associated with domestic violence. And we need to create a network that gives them a way out to feel safe and secure, so that they can rebuild their lives. But I don't want to bring these two together. I don't know enough details associated with it. I specifically am talking about domestic violence, and I want to say to women and children who are out there, and if there are women listening to this interview, if you are living in fear, reach out to one of our organizations to provide you with support. You know that we as a province are there for you and want to provide you with a way out of that violent situation to help you start rebuilding your life and that of your children.
Next, we'll go to Olivier Lefebvre, Radio-Canada. Go ahead.
Merci, Tina. My question is for the Premier. New Brunswick government says interprovincial borders with Quebec and Nova Scotia will remain closed for the summer. So many people are trying to plan what their summer is going to look like, their life this summer. Can you tell us if New Brunswick, Nova Scotia, interprovincial restrictions will remain in place at least for the whole summer?
Oh, if you look at our border right now, it's an information at our border. If you're coming into our province, we need to make sure that you have to self-isolate for 14 days, no exceptions. Need to know where you're going, what's the purpose of it. If you're coming into work, essential service workers, there's some along that border that are coming into work that are going back home, back and forth. But in terms of when all of that changes, whether it's at our New Brunswick border border or the airport, that'll all be determined by the work that Dr. Strang is doing now and the work that we'll do with public health. It'll be based on the epidemiology of our province and the risk associated with it. So we will continue to work in partnership with public health to provide the best advice to Nova Scotians and the best direction for our province based on that.
Olivier, go ahead with your follow-up.
Yes, so just to follow on that answer, Premier, you say that people coming in Nova Scotia, they're handed out information saying that they need to isolate for 14 days. So are you saying that Nova Scotia is open for visitors, at least if they only need to isolate for 14 days, but they still can come in our province?
What we said all along is that when you were coming into Nova Scotia, that you needed to self-isolate. One of the issues that we saw early on, we were one of the first actually to put some restrictions around entry points coming to our province, because what we were finding out is actually Nova Scotians weren't self-isolating. We saw a lot of people coming home from down south. We saw people who were driving coming in who weren't self-isolating. They were coming home and stopping at the grocery store on the way by, stopping at any other facility, or moving around their community. That information session was for everyone across that border, but specifically to tell Nova Scotians, these rules apply to you too. If you're coming back into our province from elsewhere, we need you to go home and self-isolate to make sure that you're not bringing the virus with you. And if you are, you will self-isolate to go forward. And we will continue on that path, and we will ask people who are coming in, what is your purpose for coming? So through this entire journey, we had families coming in who were picking up children who were at university. The direction for them was to go pick up your children and then return home. We have some people crossing our border who are working in the Amherst area. We provide them the path through, and then we expect them to go back home. That's the kind of position that we've taken and continue to work with. And I want to thank all those who've continued to cross the border for following that direction.
Next, we'll go to Lindsay Armstrong from All Nova Scotia.
Thank you. Dr. Strang, our first restrictions were eased May 1st with some parks and trails. You said that ideally there would be a 28-day period before progressing towards the next step. Based on the epidemiology, do you see any reason why phase 1 would not start at the end of May?
I mean, certainly looking at it, say, we're in that space of time, end of May, early June. But again, we have to continue to watch the epidemiology and also, getting the plans in and do those plans that they make sense. So we're actively doing all that work, and while we're doing that, continue to watch the encouraging signs of our epidemiology.
Go ahead, Lindsay, with your follow-up.
Yeah, I'd like to clarify to see if just a yes or no on the end of May. And to repeat my question from Friday, what businesses will fall under phase 5 and not be able to reopen until there's a vaccine?
So we're not at a point where we can give a definitive date, even though you want me to. I said we're in the range of in the next few weeks in all likelihood, but we have to continue to do some work, and before we can be more definitive on that. Again, in phase 5, which is the national framework, it doesn't specifically say what is in and not in any of those phases. It gives some suggestions. I think the reality is that by phase 5 is really where we have good control of COVID-19, whether it's through naturally developed through infection, high levels of herd immunity, or a vaccine, and by that point most things would be open. The things that are going to open the last, whatever phase you want to give them in, the things that we have to be careful about and sequence towards the end are going to be events that bring large numbers of people together in close proximity. So think large gatherings, whether they're large social gatherings, sporting events, cultural events, because we know the experience of COVID-19, that is one of the key things that drives significant transmission. Use the example of I've used it before. There was a very large dental conference in early March in BC where there was 1 or 2 people identified as who were infectious at that conference. conference, which led to large numbers of other people infected and a huge volume of work by public health across the country trying to follow up all the hundreds of people who were at that conference. So I use that as an example, is that those are the type of events that are going to be well down the road and towards the end of any sequencing of incremental opening of a range of businesses and other kind of community events.
Next, we'll go to Katie Hartite from News 95.7.
Thank you. The Halifax Regional Municipality has an election planned for this October. As of now, are municipal elections safe to go ahead as planned? And if a decision isn't yet made on this, when can we expect one?
So we have communicated, Minister Porter has communicated through to municipalities that the elections are slated to go this October. That has not changed. But as we get closer and continue to move through the summer and closer to the fall, we'll continue to get advice from public health. If something were to change, we would communicate that to councillors. But as of now, we expect those elections to happen at the original on their original date.
Go ahead, Katie, with your follow-up.
Okay, and I would like to touch more on domestic violence. The Globe and Mail today is reporting that at least 9 women and girls have been killed in domestic homicides in Canada during the pandemic. And we know that one of those was in Hammonds Plains here in our province. As you mentioned, we're also learning that a former neighbor of the gunman behind last month's shooting reported his domestic violence to police 7 years ago. So I'm curious if you think that Nova Scotia is doing enough to ensure that women and girls are safe here in our province.
You're never doing enough, quite frankly, if women and children are living in fear. I can't say it any plainer and straighter than that. It will take a collective group of us, not just government, across our province to ensure that women and children who are living in fear or feel that they have no other options understand there are options. But when you hear that it is still happening and people are not leaving that environment, we need to continue to do more. And we as a government will. And I think we as a society need to do, all of us need to do our part to provide that support and let those women and children know that there are caring, loving people in this province who want to support them and want to protect them and build an infrastructure that allows that to happen.
Next, we'll go to Jennifer Henderson with the Halifax Examiner. Go ahead, Jennifer.
Hi. Good afternoon. This question is for Dr. Strang. Given the asymptomatic nature of this virus, which we continue to learn about, why not allow people to get tested for COVID-19 even if they don't have 2 symptoms, especially if the individual has been directly exposed and is self-isolating and going to return to work after 14 days? Why should that individual, not be able to request a test?
So we actually are people who are identified as close contacts when we follow up cases, and that includes people in when we have a case in a long-term care facility and healthcare workers who have been involved. We actually do use testing, whether people have symptoms or not. It's just that to take the test out and test a large number of people and not consider symptoms, we know that any test that the lower the likelihood of actually having a positive result before you even use the test, you're going to have more and more errors in the test. And clearly the guidance at a national level, we've been discussing this a lot around testing strategies as we move out of phase 1, and it's been identified clearly that you doing broad-based testing of asymptomatic people, not only is it not a good use of lab resources, but also can produce a lot of inaccurate results, and actually you can actually be creating harms to people by doing that. So it's important that we follow an evidence-based approach, and the current type of test that we have, use that in an appropriate way based on our work between public health people and our laboratory experts.
Go ahead, Jennifer, with your follow-up.
Just with respect to hospital services, elective surgeries, and diagnostic tests, I know you told us last week you were in active discussions with the NSHA. Is there anything further you can tell us as to, when when those types of services might resume?
I don't have an update on that. If I said I was involved in discussions, I'm not sure that's what I said. I mean, those discussions are happening. I'm not directly linked into those conversations, but we can certainly look and get an update to bring forward in the near future.
So the minister and his deputy minister have been working directly with Nova Scotia Health Authority, the IWK, and our external partners to look at dealing with a day surgery or short-term stay that can happen within our healthcare system. They'll work through that without overloading the system to make sure it is still there, that if COVID needs a response. That work is ongoing. There has not been a definitive date of when that may start, but that work is ongoing and they will continue that. And as soon as we have an update, we will let all Nova Scotians know.
That's all the time we have for questions. Go ahead, Premier.
Thank you, Tina. There's been lots of questions and lots of concerns about when we are going to open up our economy. Dr. Strang is still in the midst of his consultation, explaining the guidelines and protocols to businesses, labor unions, and associations. Those groups are then expected to work with their own members to help them figure out how they can operate under the public health protocols. We are here to answer any questions that they may have on how that might look, what that might look like for them. When the consultations are complete and Dr. Strang has seen good results on flattening the curve, he will come back and advise our government on the results and his comfort level in opening up our economy. And I'm getting lots of questions asking about a date. When are you going to open the economy? I've been working with my ministers and will continue to work with our ministers. And while you don't see any of them here today, let me assure you that they are working each and every day on behalf of all Nova Scotians, not only ensuring they're administering their departments, but looking after their own constituents, as I'm sure all MLAs are. When my cabinet and I have received the advice from consultations from our public health officials, we will come back to all Nova Scotians with a date and a more specific plan. Other provinces have already opened up, some quicker than others. We are amongst the last, but remember, we were the last to receive COVID. This is not a competition. We are not in a race. We need to be safe. We need to continue to see a pattern of fewer cases. That happens, and I feel confident that we are getting closer to a gradual opening. I need to be sure that Dr. Strang is confident in the science, and I want you to be confident when we open up.